Addictions to drugs and alcohol is a problem that plagues many families across our nation. I am Dr. Albert Janrich, and I am pleased to report that these suffering families are not without hope. As Medical Director of Clearbrook Treatment Centers, I am delighted to offer you an incredible opportunity to get out of the problem and into the solution. Welcome to Clearbrook.
I wanted to stop every night. And every night I told myself it was literally going to be the last time. And the next day I would be right back at it.
I didn't think I'd be able to stay drug-free for a day because it had been years since I went a day without using.
For over 20 years I was a full-blown alcoholic.
Wanting to live was a battle every single day.
And I couldn't stop.
I hurt a lot of people. I hurt the people that cared about me most, my family, my friends.
I was always looking to get out of myself and through drugs and alcohol, and it was just not a good way to live.
The beauty of my job here is that I see very broken people struggling with themselves and their life come in. And in a very short period of time, clearing detox, going through the program, it's like watching a flower open up.
Every day a miracle happens. People change their lives, people get well, people get better.
There is hope. Hope with this illness.
My life after Clearbrook is livable.
Clearbrook gave me my life back and showed me how to live it.
This is a place where miracles happen.
It's just your standard kid. I grew up in a good childhood, good family, Catholic school.
I just never fit in. I didn't have any friends.
I was probably just a normal kid.
I just didn't fit. Felt less than, felt inferior to a lot of people.
I played sports. I played basketball in high school, in middle school. I went to church.
The first time I drank, I was at a party when I was 14, and I tasted it, and I thought it was the grossest thing in the world. And everybody just kept telling me to just keep drinking, keep drinking. And then I kept drinking, and like 15 minutes later, I started to feel all warm and fuzzy on the inside. And I knew from that moment on that this was it. This was what I've been missing my whole life.
It just made me feel more important, made me feel better about myself.
I would drink and I would black out and I would make awful decisions, and it was just really taking a toll on me and my family's sanity.
All that I really did was drink and use drugs, and I brought down myself and everyone around me.
When I introduced drugs into the mix later in life, in my mid-30s, it fell apart fast.
Before I knew it, I had a serious problem on my hands.
I knew something was wrong, but I didn't understand that there was something that could be done about it. I just thought that that was the way my life was going to be.
It was Clearbrook or take my life.
The first day at Clearbrook was a haze. I knew I needed to be there because I knew I was going to die if I kept doing what I was doing.
I was a really angry, aggravated person when I first got there.
I didn't have a lot of hope the day I got there.
I was angry. I wasn't following direction. It was violent.
Every negative feeling you could possibly come up with is how I felt. I'm more so scared than anything else.
I was helpless, absolutely helpless.
I was really mad at myself.
I knew it was the first time I was safe and okay in a long time.
But at the same time, I felt like things were going to get better.
Last day at Clearbrook, I was scared to death. I was on my way out. I didn't want to be there the whole time I was there, and then when it was time to leave, I was scared to death to walk out of the place.
Maybe life was possible without drugs and alcohol.
I had made it a couple weeks without using, and I was starting to feel a little bit better, and I knew that if I could do it one day, I could do it another day.
My last day, I had some faith that I could go on and live the life that maybe I was supposed to live, finally.
I work with the patients from the time they come into detox until they finish treatment, through every phase of their treatment, try to deal with their problems, personal, legal, whatever their problems are.
Our detox is a homey atmosphere. We treat the patients like they're our family members. We make them comfortable, we make them feel safe, and we love them until they can love themselves.
So I get to see people come in at their sickest and go home somewhat well. It is unbelievably rewarding to see somebody come in at their very, very sickest, and we get to see them build themselves back up, get physically better, and then get mentally better. And when they're walking out of here holding their heads high, it's really, as corny as it sounds, it's probably the best feeling you could possibly get.
We do have 24-hour nursing care here at Clearbrook. We have 3 to 4 nurses on day shift, 2 to 3 nurses on 3 to 11, and 2 nurses on 11 to 7. We're taking away their best friend when they come in the door. We're taking away that bottle of booze. We're taking away those pills. So we have to develop some kind of trust with them that we are going to make sure that they're going to be okay. We're going to make them feel comfortable. We're going to take the edge off for them with medications because we are a medical detox.
When a patient walks through the door, they don't know what to expect. A lot of times they're frightened, concerned, and we just like to make them feel as comfortable as possible.
When I first meet my clients, I already know that they're very nervous. Most drug addicts come into treatment and they don't trust very much. So I know that coming into the session, and they're most often externally motivated to come into treatment. So, you know, my goal in that session is to try to get them to have some kind of internal desire to want to get sober.
Once the patient sees that we're doing the best we can for them, we have established some sort of a trust level.
For the most part, yes. Everyone has to be broken to think it's a good idea to come to a treatment facility. You know, their life is not working for them. Their best efforts are not working for them. They have relationships, love relationships that are upset with them. Sometimes they have the legal system upset with them. And they're confounded, lost, angry, and hurt.
They really are wanting to know, is there help for me? I have tried this on my own many times. And they want to know, can you help me? Can God help me? They really want to know, and they come wanting to know and hoping you have some kind of help. They know you can't necessarily fix it all, but do you have something that can make this easier and for me, or to help me get my life together?
The staff actively practices accepting and loving people and meeting them exactly where they are. It is both professional, but just as important, it is very, very human in the way they put their arms around folks here.
One of Clearbrook's main core strengths is our staff. We have people that have been here 30 years. In most jobs today, people don't stay 30 years.
I myself have been involved with Clearbrook for going on 23 years as a contractor, and now for the last 3 years as the facilities director. There's a lot of people that have a lot of time in Clearbrook. This is a pretty good place to work.
I love my job. I love working in drug and alcohol. If I didn't, I wouldn't be here.
I get to watch my patients grow from the time they come in and they're so beaten down, helpless and broken, and watch them grow into healthy, happy people by the time they leave.
My favorite part of my job is seeing the hope in patients. Watching somebody walk into treatment broken and then walk out with a little bit of hope for life and the tools to accomplish that.
My favorite part is preparing the food and seeing the people smile and appreciate the cooking.
There are a collection of professionals here that love their work, love the people they work with, and meet and greet and accept people exactly where they are in the worst period time of their life.
We have the best staff here that I've ever seen. As I said, each individual counselor brings something really unique to the table and are incredibly helpful.
Clearbrook definitely works as a team in all our facilities. We are a team, but a little more than that, we're a family. We all know each other very well. We all work together. Most of us have been working together for a long time.
We really rely on one another to help one another. And it's not only about, helping the patients at Clearbrook, we help one another also.
Clearbrook's a family. A lot of organizations say, yeah, we're family, and spin that line. But you're a family when people stay for long periods of time. And what we're trying to do is pass on that family feeling and make people understand that it's not just a line, it actually is true.
Here at Clearbrook, patients always come first.
It's always patients are number one, and that's what we're here for. We're looking out for the patients. That's our job.
That is a mandate here that patients come first, no matter what it is. And that's from wake up in the morning right through the evening. We are here to take care of the patients. We are the healthier members of this community, and we are to take care of patients and all of their needs from the moment they wake up until they go to sleep. But it is absolutely, positively patients first at Clearbrook.
Most of the Clearbrook staff here, probably well over 90% of us, are also in recovery ourselves, including myself. I'm not only an employee of Clearbrook, I'm also an alumni of Clearbrook. The tools that I was taught in Clearbrook and continue to teach patients now absolutely work. And I have a personal investment in Clearbrook because they really saved my life. They changed the way I looked at the world, and my life has changed dramatically because of it.
We meet twice a day, 8 o'clock in the morning and 3:30 in the afternoon. All of the counselors, myself, and a representative of the medical department to discuss every single patient. Everyone brings something to the table, and everyone is different. Every counselor is different. Every medical person who works here is different. They all bring something unique to the table, and by spilling out our problems with any particular patient into the room that day, we get a much better overall picture of the patient and how we can help them.
Recovery is all about solutions. Addiction is the problem. So as bringing the team together and discussing solutions for the patients, we are a solution-oriented treatment center.
It made me feel very comfortable to see that our supervisors are just as involved in the treatment and the care of our patients as we are.
Everybody knows their job, and they does their job very, very well.
This is my purpose in life, and I love what I do.
When a person leaves here, they have a complete aftercare program designed for them by us. And that's another one of the things that we meet on every day. We talk about what aftercare is going to be appropriate for what patient.
What we've tried to do is narrow down the number of treatment facilities, outpatient providers, extended care providers that we believe will offer the type of treatment that will match the needs of the patient. So not every patient would go to the same facility that we have on our list of, call them preferred providers. There's no back and forth here. This is done strictly for the patient. The recommendations are made based upon what our belief, clinical team's belief is, will be their next best clinical level of care. We're raising the bar, and our expectations are going up a notch as we move forward.
We've gone from one type of facility to a totally brand new, state-of-the-art campus.
We are presenting to patients not only a clinical treatment experience that has always been very, very good, but now the other component, which is the living experience, where they actually stay.
We've gone from our dorm and detox, new facility, to our dining hall and brand new kitchen. We've renovated our gym, which is our recreational area, and now we're developing a new park. What we have here is like a fine hotel. It's not, they're coming from some pretty bad situations. They're landing here, and this is really a nice, well-maintained. It's a fine hotel. That's basically what we have for the living conditions. And the rest of the facility is all brand new and beautiful.
I destroyed my family, which is, I think, what hurts the most, really. There are a lot of really wonderful people that had no idea how to handle what I was doing to myself and I had no idea that what I was doing to them at that time.
The families don't know what's wrong. They make things up in their head. They make irrational things. They think maybe it's the school, or maybe it's the parents, or maybe it's the neighborhood or the job. It's always something other than what it really is, which is the illness of alcoholism.
Parents would rather believe their son or daughter is, and would rather tell someone, my son or daughter has depression, my son or daughter has anxiety, than say, my son or daughter is an alcoholic or an addict. So they start the route of psychiatry, and they're given all these labels, and then we have to peel apart these labels, and it's very, very difficult.
The stigma of addiction in a family is really disastrous, because what ends up happening is the secret can kill people. And if people are open and honest about it and willing to talk about it, then family members can seek help.
We're committed to the family independent of the patient's progress or lack thereof here. We have an inpatient family program. We're committed for them to have their healing, although in an ideal way they want their alcoholic or addict to be better, but if not, that they can make peace and move on with their life in a realistic and practical way.
The first day I sat across from Nick Colangelo, and he gave me the information that my son had admitted he had a drug addiction and needed help. I was devastated and I didn't know what to do. And he handed me a phone number, his phone number, and he said, you can call me anytime. And I remembered being overwhelmed by that, thinking to myself, you know, I've never been to a physician that gave me his home phone number and said, call me anytime. And I realized at that moment that his main concern was that my family get better, that our family get back together and be a unit again the way we had once been. And I think that feeling has come across through the years. Clearbrook is a family-oriented program. It's something that wants families to get better together, seek help together, and it succeeds in that. If a patient gets help from their family and support from their family, their chances of success are higher. That doesn't mean that the patient can't get better whether the family does or not, but it also doesn't mean that the family member can't get better whether the patient does or not. But the percentage is higher when everybody is working toward the same goal, when everybody is in a recovery program, when everybody is speaking the same language, if you will, language of recovery, when everybody is working for as hard as they worked in addiction, that they work in recovery and recover together. That's the ideal situation, and that's the goal that we have here at Clearbrook.
Families, as they send their loved ones here, often expect a miracle. I often repeat that this is not a car wash. You know, you come in one side and you go out the other. It's the beginning of a process that's very complex. And interestingly enough, whether it's the family or the patient, they must bring a willingness to do the work and to do the new things that promote that peace of mind and that healing. However, families have this very short view most of the time of, okay, they're going to go there, stop drinking, and we'll live happily ever after. Not quite the way it works out.
Like any disease, if my child had a disease of another sort, I would be seeking out experts in that field, and when you do that, you not only have hope, but you learn the ways that that hope becomes a reality by the experiences you need to go through and what your family member needs to do as well. The family member is addicted to the person, the alcoholic, and they become preoccupied with that person, if you will. They wind up, the minute they wake up in the morning, what are they doing? Are they in a good mood? Then we're in a good mood. If they're in a bad mood, then they get to be in a bad mood. They keep circling around and around about this person. Now this person is addicted, and they have a broken brain. And as family members, we are looking to them to make decisions for us, make judgment calls for us, and the person's not capable of doing that. So we wind up wondering what they're doing, where they are, who they're seeing. Are they drinking? Are they not drinking? If they drank, how much did they drink? Where's the money? How much money did they spend? And we have all these questions going on in our brain all the time. So when you're not paying attention to yourself and your own reality, you're paying attention to somebody else's, you become neurotic. And that's a lot of problems families have. They're not living in their own reality. They're living in the reality of addiction. And that doesn't work very well.
Clearbrook has brought my family back together. They have showed me how to appreciate my family and helped my family to understand a little bit about myself and where I've come from as well.
The family program at Clearbrook consists of a weekend program. We call it Focus on the Family. And families come here Friday through Sunday, and they spend a weekend with us here so they can learn what happened to them. It's an educational program and how for the families to get into the solution. Everyone gets affected by this illness. It has very long tentacles. It's generational, the effect on the family, as well as now, and they suffer. They're in a lot of pain. They have a lot of frustration, confusion about what happened to them, what's going on in their life. Very, very infrequently they call it alcoholism. They don't know. They don't know.
I think Clearbrook has proven itself, not only in what we are, or the people that work here, not only the facility staff, but all of our staff, our clinical, to the people down the hill, getting the intake, getting people in. You've got a lot of good, caring people working here that care about the people that are coming in and want to get them better.
When I was using, I couldn't even dream that I would have the things going on in my life today that I do.
My life after Clearbrook is good. I go to school and I am able to work. I can take care of myself. I'm happy most of the time.
It's just wonderful to see the healing and people getting on to graduate from school and their hopes and dreams becoming fulfilled.
We don't send anyone back out into society until they're ready to go back out. There's no rush here. And we delve into each person's background. We try to find the right setting for them when they leave treatment also, whether it's a sober house, a halfway house, or just back to their own home and back to AA meetings, etc.
Life after Clearbrook has been challenging and rewarding and has made me be a better person.
I have choices today. I can wake up, go to work. I have friendships, I have relationships. I don't have any real problems today. And more than anything, I have peace.
My life after Clearbrook is doable. I can face what happens in life almost like a regular person.
My life after Clearbrook was rough at first, and I was able to get through it without drinking. And after giving it a little bit of time, things started to get better, and my life has gotten really good. And I have dealt with things and have gotten through things that I never would have imagined that I didn't have to drink or drug over.
From initial contact to full recovery often takes between 2 and 7 years in a variety of treatment possibilities and opportunities. So because of the longevity of our programming and because of our involvement in it directly, we see people come in again in grave difficulty, and later on I see them out in the community graduating from college, Fulbright scholars, becoming married, raising their families and children, so it's extraordinarily rewarding.
When somebody leaves here, I know that they have been given our very, very best.
I wouldn't have finished college, which I have. I probably wouldn't have a good job like I do, and I probably would not have the relationships with my friends and family that I value very highly today.
Clearbrook made me into the father that my kids deserved.
I wouldn't have anything that I have in my life today. I wouldn't have a place to live. I wouldn't be in school. I would just be going nowhere.
My son is going to be 7 years sober, and he's 28 years old, and that's a big deal. It's not so easy for a 28-year-old to turn their whole entire life around.
I would just say thank you, Clearbrook, for showing me how to live and showing me how to be a good person.
Thanks for helping me and the rest of my family get our lives together.
I can face whatever challenge the day has for me without needing to drink or drug to get through it. It lets me appreciate the great days, and it lets me live through the bad ones.
When people come to Clearbrook for treatment, all that we're offering them is an opportunity for a sober life and to get their life back.
I want the person suffering from drugs and alcohol to know that if they come into treatment, if they're brave enough just to walk through that door, that we can help them.
We've all taken different roads to get here, but we all wind up in the same place.
I would like the world to know there is hope. Hope with this illness, because it's so hopeless when you're in the midst and in the throes of it. It appears so hopeless that I would like the world to know there is hope. And in that hope and on the other side, in recovery, life becomes amazingly different, like worlds apart. People grow, they learn how to be spiritual, physical, emotional, and in a balance rather than so out of balance. So for the message for me would be hope. Take courage, take the first step, ask for help, get the help, and the sky's the limit where you can go.
Patients have nicknamed the mountain magic. I've referred to it as Magic Mountain.
There's definitely something magical. People get better and families get better.
Today I have 2.5 years of sobriety.
Today I have 6 years.
14.5 years.
I'm in my 7th year of recovery.
Today I have 13 months.
3 years sober.
Today I have 3.5 years of sobriety.
When we see laughter return to dark eyes and hopes materialize, people leave a lot of pain on this hill at times in their life, and when they leave, they have a lightness, and it's like little stars in their eyes. Why wouldn't you call it Magic Mountain?